Hello, and welcome to today's webcast, DUOBRII for Patients, Understanding Psoriasis, Treatment Options, Resources, and Ways to Help Yourself, sponsored by Ortho Dermatologics. My name is Bev Bromfield with the National Psoriasis Foundation, and I'll be your moderator for today's presentation. Before we start, I'd like to go over a few items so you know how to participate in today's event. You should all be logged in to GoToWebinar and see a control panel on your computer's desktop screen in the upper right corner. You have joined the presentation listening using your computer speaker system by default. This means if you can hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. This webinar is being recorded, and you will receive a link to the recording after today's presentation. At this time, I'd like to introduce our speaker, Dr. Jennifer Song. Dr. Song is a board-certified dermatologist and the Director of Clinical Research at Southern California Dermatology in Santa Ana, California. Dr. Song has a strong interest in medical dermatology and clinical research. She is an expert in treating chronic inflammatory skin diseases and has extensive experience using phototherapy, systemic medications, and biologics. She has authored several peer-reviewed journal articles and lectured at professional meetings to talk about new advances in the treatment of psoriatic diseases. Dr. Song previously served on the UCI School of Medicine faculty as an assistant professor of dermatology and the director of dermatology clinical research from 2010 until 2015. And now she is an associate professor at Harbor University of California in Los Angeles. On behalf of today's program, I'd like to read the following disclosures. Dr. Song is a paid speaker presenting on behalf of Ortho Dermatologics, and Ortho Dermatologics is the sponsor of this program and event. This program contains information about an Ortho Dermatologics product. The information within this presentation is consistent with FDA guidelines. At this time, please welcome Dr. Song.
Thank you, Bev. I'm really excited to be here today to talk about a new topical treatment for psoriasis. I'm a doctor who takes care of patients in a regular medical clinic as well as a doctor who does clinical research. That means I help develop new medications for chronic skin diseases like psoriasis. I've always loved clinical research because developing better medications can help millions of patients. And today my goal is to share with you one of these new medications. I've been an investigator for psoriasis treatments for over 10 years now, and it's been amazing to see all the new treatments that are now available to patients. Today, we'll be focusing on a new medicated lotion called DUOBRII. Here you see an overview of what we're going to be talking about today. We're going to start with an overview of psoriasis, living with psoriasis, and talking about psoriasis treatment options and goals in general. I want to make sure we all start off on the same page, and some of you may be just beginning your psoriasis treatment journey or considering starting treatment with psoriasis, or may have had psoriasis for a while. And then the latter half of the presentation, we'll talk about psoriasis advocacy, and then the bulk of our conversation is focusing on the new medicated lotion called DUOBRII, so treatment innovation, and then concluding with questions and answers. So we're going to start with an overview of psoriasis. What is psoriasis? It's a common chronic skin condition. It develops from an overactive immune system. While many patients ask me what exactly triggers psoriasis or causes psoriasis, doctors and scientists don't actually know. It's a combination of your genetics and probably something in the environment that triggers the disease or unmasks the disease. It's due to an overproduction of inflammatory proteins that then cause new skin cells to form in days rather than weeks, and then the body's unable to shed these excess skin cells, and that's why you see a pile up these silvery scales on top of the skin patches. The extra skin cells pile up and form silvery scales and red patches on top of the skin, and these are called plaques. In some patients, about 30% of patients, the inflammation can actually extend to the joints that we see here, and that's called psoriatic arthritis. There are actually 5 main types of psoriasis. They're all called psoriasis, but there are actually slightly different because of the way they look. And it might look like they're completely different skin diseases, but they actually share a lot of common features under the microscope. So they are actually considered subtypes of psoriasis. The most common type of psoriasis is plaque psoriasis. This is your typical dry, raised, red skin plaque covered with a classic silvery scale. Another type of psoriasis is called guttate. It actually means drop-like in German. This primarily affects young adults and children, often triggered by a strep throat infection. These look very different. So these are small, scaly lesions that are shaped like water droplets. Another type of psoriasis is inverse psoriasis. This mainly affects the folds of the skin. So the armpit area, the groin folds, and then underneath the breasts and around the genitals. These patches may not look so scaly because they're in moist areas of the skin. So they're smooth patches of red inflamed skin. Sometimes these areas can be much more sensitive or even painful because the skin is rubbing against skin, which makes this area sometimes a little bit harder to treat. Another form of psoriasis is called pustular psoriasis, where you actually get tiny yellow pus-filled blisters surrounded by red irritated skin. This is an uncommon form of psoriasis, but often can happen just on the hands or even in some rare situations be more extensive over the entire body. And there are very few emergencies in dermatology, but this is one where a patient may need to go to the hospital. As well as the last form of psoriasis called erythrodermic. Again, this is another uncommon form. In fact, it's actually the least common, where the entire skin of the body is covered with a red peeling rash. The severity of psoriasis can vary. Doctors like to put it into different categories, so we call it mild, moderate, or severe. And how we define how severe your psoriasis takes into consideration many things. So here we see some categories based on how extensive your psoriasis is. So that's the body surface area. But location of your psoriasis is also really important, and the type of psoriasis you have based on the 5 different types I had talked about before. Again, going back to location is really important because if your psoriasis primarily affects your hands and feet, even though that might account for a smaller body surface area, that can be very debilitating because it interferes with your ability to walk or even do your daily activities with your hands. And then you can see your severity is also classified by how it affects your life. I think this is really important. I always ask all of my patients, how does your skin affect your life and what are your treatment goals? For every patient, this can be different. Here you see one way of categorizing disease severity based on body surface area. So generally, mild is considered less than 3% of the body. Here you can see the definition of what 1% of your body surface area is. It's about the size of your entire hand. So that's your palm, including your fingers. So if you look at mild, that's about 3 hands of psoriasis. And then looking at moderate is anywhere between 3 and 10 palms of psoriasis on the body. And then anything more than 10 handprints of psoriasis is considered severe. And generally speaking with your doctor, you can help determine the extent and severity of your disease and also tell your doctor how it affects your life. So now moving on to living with psoriasis. We've actually learned over the last 20 years that psoriasis is really not just a skin condition, and that really the inflammation, when it spreads to other areas of the body, can have greater risk of developing other types of health conditions. Many patients are really surprised to learn that the inflammation of psoriasis can cause joint damage. Like I mentioned earlier, 30% of patients can have psoriatic arthritis, and that's when the inflammation damages the joints. We now also know, based on a lot of research, that there are also certain types of skin cancers that psoriasis patients can develop. Psoriasis patients, despite controlling or eliminating other factors, are also at higher risk for developing type 2 diabetes, higher blood pressure, as well as high cholesterol. The heart disease story is very, very clear. Because of the inflammation in psoriasis alone, patients are at higher risk for having a heart attack, even if you eliminate smoking, drinking, and cholesterol. So there is something unique about the inflammation in psoriasis that contributes to that heart disease and heart attack risk. Psoriasis patients are also at risk for other autoimmune diseases like Crohn's or celiac or multiple sclerosis. Also Parkinson's disease and certain types of inflammatory eye conditions, even kidney disease, as well as obesity. So it's really important to make healthy choices and watch for these conditions so that your doctor can help you manage them. And in all of my psoriasis patients, I always suggest that they are seeing a primary care doctor to help them with all of these other health conditions that are associated with their skin. Here are some strategies for coping with psoriasis. Patients often ask me all the time, well, what can I do to help my psoriasis? Is there anything I can do to make it better besides using a medication? So here are some other things that you can do to lessen the severity of your psoriasis. So first, figure out what triggers your psoriasis. There are certain things like infections, such as a bad cold or a flu, even certain types of injuries to your skin, such as a tattoo, can also trigger psoriasis. Stress can absolutely make your psoriasis worse. Smoking, as well as intense sun exposure. I had one patient who forgot to put on sunblock when they went to their sister's graduation and got a sunburn and triggered her psoriasis. Other things, lifestyle changes that patients can make to help improve their psoriasis is avoid drinking. So if you do drink in moderation. There are also certain foods that can worsen inflammation, such as processed foods, refined sugars, fatty red meat, and dairy. While there aren't any specific foods that can improve your psoriasis, I tell patients that your systemic health is most important and that your skin is actually a representation of your systemic health, and so that eating good foods will also help the other health conditions such as the overweight, the high blood pressure, and the diabetes. So again, leading to my next point you can see is reduce caloric intake to obtain a healthy weight. So ultimately, a healthy diet and a healthy weight go hand in hand. And then ask your doctor for more information about psoriasis support groups in your area. You can see at the bottom, the National Psoriasis Foundation is an amazing resource for locating groups. I refer my patients all the time, all of their great online information for patients regarding different resources such as finding the right healthcare provider, right dermatologist, and just learning more about their disease. And I think that's really important that patients also empower themselves to learn about their disease. Here we talk a little bit more about taking care of yourself. So I think this year there was a lot, there's a lot of emphasis on taking care of the patient as a whole. We all talk about integrative health, and the National Psoriasis Foundation published a food and diet recommendations for psoriasis. So you can see here highlighted in bold is stay active and exercise and help. I think we all know that exercise is important, so often easier said than done. But maintaining a healthy weight and exercise go hand in hand. Exercise can also increase the production of these neurotransmitters called endorphins that make you feel good. Other great benefits of exercise is relieving stress, increasing self-confidence. It can reduce symptoms associated with depression and anxiety, and improve your sleep. So all of these things can help reduce your overall stress level. Again, going back to diet, while there's little scientific evidence that any specific diet can improve psoriatic symptoms for everyone, a balanced diet is most important. So the National Psoriasis Foundation wrote very detailed guidelines and looked at all the different studies with regards to even specific types of diet. Ultimately, the scientific evidence showed that a balanced diet is most important. This consists of lean proteins, whole grains, fresh produce, and healthy fats. And some call this an anti-inflammatory diet. Something like the Mediterranean diet also includes all of these things. My personal recommendation to patients is that your diet is something very personal and social as well as cultural. So trying to incorporate all these things is really important so that you make lifelong changes and not short-term changes that you can commit to. All of these changes can also help reduce the risk of other related conditions like heart disease and diabetes. And then the second key recommendation is a low-calorie diet for patients who are overweight or obese. That has been clearly demonstrated in many studies over and over that having a healthy weight, achieving a healthy weight is really, really important in improving your psoriasis and lessening the severity of the disease. Okay, so now we move on to psoriasis treatment goals and options. Here is an overview of different treatment options, and many companies are continually researching and developing new treatments, but at this time there is no cure. There's many ways of controlling the inflammation in psoriasis, so that's the good news. And we'll go over the main categories of different treatments. So treatments can help manage your symptoms, and of course the goal is clear skin. But I always ask my patients what their individual goal is. Lifestyle changes, again, we talked about healthy weight, healthy diet, keeping your skin moisturized, stopping smoking, and then managing your stress. Those are the lifestyle changes that you can make. And then they go hand in hand with the medical treatments. So medical treatments, depending on the type of treatment you and your doctor choose, the goals are to reduce inflammation, whether from the inside or from the outside using a topical, and then achieving clear skin, called clearance or remission. So here are the different types of psoriasis treatments. These are the large categories. So topical treatments are lotions, creams, ointments, shampoos that you apply to your skin from the outside. They can be prescription or over the counter. There's light therapy where you expose your skin to specific types of ultraviolet light, and this helps to decrease the inflammation at the skin level in psoriasis. And there's also oral and injected medications, and these are pills or injections that can decrease the inflammation in the body's immune system, also called systemic or body-wide treatments. Today we're going to be focusing on topicals. So here, topical treatments are often the first option for treating mild to moderate psoriasis. So there's several options you see here. Topical steroids have been the mainstay of treatment for many, many years in psoriasis. Topical retinoids we'll also be talking about today are vitamin A derivatives. Calcineurin inhibitors decrease inflammation in a different way through a different pathway than steroids. Salicylic acid is available over the counter as well as prescription strength. It's used to help get rid of that thick scale on top. Even vitamin D derivatives can help normalize the overproliferation of the cell cycle in psoriasis. Therapies like topical anthralin are not as used as often anymore because we have more elegant treatments now. Anthralin can be a little bit messy, and other things that can help are moisturizers, as well as coal tar used to be a long traditional treatment, but not as used often because it tends to be messy. I'm just going to briefly mention, and you can see here the different types of oral medications. Retinoids, methotrexate, and cyclosporin are generally considered oral medications, while methotrexate can be given as an injection. And then biologics, which are specific proteins that are injected into the skin and body to block inflammation or decrease inflammation in psoriasis. So here I want to talk about the National Psoriasis Foundation's work. So about 2 years ago, there was a treat to target goal. So establishing a measure to define success in psoriasis treatment, because we now have really great treatments, and we want doctors to know that dermatologists can really help many psoriasis patients now. And so you and your doctor would decide what on the best type of treatment. But the goals would be, after 3 months on a specific treatment, the goal is to have less than 1 to 3% of your body surface area affected by psoriasis. The other goal would be, have you had 75% improvement in your skin? After 6 months on a treatment, we're hoping that less than 1% of your body surface area is affected by psoriasis. So these are general treatment goals. It also shows other doctors that we do have lots of great treatments for psoriasis that can get patients to these levels of clearance. What are some treatment concerns and challenges that patients have told us? Many of our patients prefer topicals over oral or injectable medicines, otherwise considered as systemic medications. But what are some of the drawbacks? Well, long-term use of topical steroids can cause thinning of the skin. So that's one downside. Topical retinoids, these are those topical vitamin A derivatives, can cause a lot of skin irritation, so really hard to use on a regular basis for some patients. Topicals also tend to stop working over time. Many of my patients share their frustration. Dr. Song, are you sure this is the same one you gave me as last time? Because it doesn't work as well as it did the first time. Other systemics are generally perceived to be more effective, but they come with more side effects. So the majority of patients in a survey who used a topical steroid treatment said that they did have skin thinning. They also had skin redness, and they were open to new treatments. So there's definitely an unmet need, and patients are looking for more or different treatments. What do you look for in your psoriasis treatment? So today we're going to be focusing on a new medicated lotion called DUOBRII. Before I get into just talking about the details of how well it works for psoriasis, we're going to be reviewing some important safety information. So what is DUOBRII Lotion? It's a combination of two active ingredients or medications. One is halobetasol, which is a topical steroid, and the other is tazarotene, which is a vitamin A derivative. In fact, these are actually two well-known ingredients that have already been FDA approved. And it's a prescription medicine that was studied and used for adult patients with plaque psoriasis. At this time, it has not been studied in children, so it's not known if DUOBRII lotion is safe and effective in kids. DUOBRII lotion is also for use on the skin only, so please don't eat it. It's not meant for your eyes and not meant for the vagina or other private areas. What is the most important information I should know about DUOBRII lotion? DUOBRII lotion can cause birth defects if used during pregnancy. This part of the important safety information comes from tazarotene, because tazarotene is a vitamin A derivative. So that means a negative pregnancy test must be obtained before females of childbearing age start using DUOBRII lotion, and they must use effective birth control during treatment. So a great time to start treatment would be during a normal menstrual period. If you become pregnant while using DUOBRII lotion, stop using it and tell your healthcare doctor right away. Some other things you should talk to your doctor about is whether you have eczema or any other skin problems, including infections, which may need to be treated before starting DUOBRII. Also tell your doctor if you have diabetes, any adrenal gland problems, or liver problems. This is because DUOBRII does have a topical steroid component in it, and in some situations, your doctor wants to also make sure there are no interactions with your other medications. Also let your doctor know if you're breastfeeding or planning to breastfeed. This is not, again, meant to be used in mothers who are breastfeeding, so do not apply DUOBRII directly to the nipple area. Also tell your doctor about all the medicines you take, including prescription as well as the over-the-counter medicines, vitamins, and herbal supplements. And most importantly, tell your doctor if you're taking steroids by mouth. So these are pills or steroid injections, or using other skin products that contain steroids. And then ask your doctor for a list of medicines that may make your skin more sensitive to sunlight. The vitamin A component of it, the tazarotene, can make your skin more sensitive to sunlight. What else should patients avoid during DUOBRII? So we talked about the sun here, making sure that you're not getting a sunburn, so avoiding sunlight, sun lamps, and tanning meds as much as possible, and use sunscreen, protective clothing, and a hat while you're in sunlight. Talk to your doctor if you get a sunburn, and don't use DUOBRII lotion on your sunburn until it's healed. Avoid using DUOBRII on skin with eczema because it may cause more irritation. Other side effects that you should know about is if too much DUOBRII passes through your skin, it can cause your adrenal glands, which are your glands that control normal physiological production of cortisol, so that's your natural steroids your body produces, to stop working. Cushing's syndrome is a condition where there's too much exposure to hormone, your natural hormone called cortisol. Also, high blood sugar, because steroids can increase high blood sugar, the effects of growth and weight in children, watch for side effects including skin irritation, and then also vision problems like cataracts and glaucoma. And this comes from the topical steroid because of this topical steroid component in DUOBRII. Again, to review, the most common side effects of DUOBRII lotion include redness, itching, swelling, burning, stinging, application site pain, inflammation around hair follicles called folliculitis, thinning of the skin called atrophy, peeling, and rash. And we'll talk a little bit more detail about these common side effects. And if you're concerned about any other reactions, you may contact the company Ortho dermatologist directly or report anything directly to them at the 800 number there. Okay, so what's new about DUOBRII and what's so different about this topical? I was actually one of the doctors who did the clinical trial on this medication. And at first, honestly, a little skeptical because I thought, well, this is just another topical steroid combined with something that we already have, which is tazarotene. And both are available separately, individually at the pharmacy. So what's different? So in fact, I'm going to show you that combining the two together in a new formulation, in this lotion formulation, really did show benefits. And in fact, it was my patients who told me how much they liked it. So this is the first and only combination lotion that uses a new technology. So you see an advanced formula for quick and lasting relief that can be used until control is achieved. So something that we see here already is that I want to bring to your attention is that there's no time constraint on how long you can use it, really emphasizing the fact that as long as you're applying it to a raised red plaque, that you can continue using it until it becomes clear. So these are two well-known ingredients, halobetasol propionate and tazarotene, in one unique lotion. And it's a once daily treatment. So halobetasol is the steroid component. That provides powerful anti-inflammatory properties to reduce the burning and itching, the inflammation in psoriasis, as well as minimizing any sort of irritation and burning that's associated with the tazarotene. The tazarotene is the vitamin A derivative. Now, the tazarotene alone has been shown to reduce skin thinning, which is one of the side effects we're concerned about using steroids, right? It can also extend the clearing process even after you've stopped using the topical. So you can see that they help each other. So this lotion formulation is also delivers the medication in a new and unique way. The medication comes in a tube. I wish I had a picture for you, but it's actually a lotion. So when you look at a tube, you're thinking thick cream or maybe like a greasy ointment, but it's actually a very elegant lotion. And my patients have told me how nice it feels on their skin. Because of this new technology and the way they've made the medication, each droplet of lotion contains both active and hydrating ingredients. So patients have said that their skin feels more soft and moisturized after using it. So DUOBRII lotion was tested in 2 clinical trials. Patients saw improvement in their psoriasis symptoms as early as 2 weeks. After 8 weeks of treatment, over 40% of patients had clear or almost clear skin. The results were also long-lasting. So after 1 month of stopping their cream, 33% of patients still had clear or almost clear skin. And I think that's very meaningful because many patients will tell me that as soon as they stop their topical steroid, within a couple of days about using it, they notice that the psoriasis already is coming back. So again, here you can see in bold, unlike other steroids that have time limits on use, you can keep using DUOBRII lotion as needed and then discontinue once your skin becomes clear. So in the clinical trials, they allowed the patients to use the DUOBRII up to 8 weeks. This is longer than other steroids that have been studied in the past, where most other topical steroids that are already FDA approved, you can only use it up to 4 weeks. Of course, if you experience skin thinning, stretch marks, spider veins, or inflamed follicles, definitely talk to your doctor. So here we see that DUOBRII lotion extends the clearing process. Once your skin is clear, it can stay that way for up to 3 months after you stop using DUOBRII. If you look at the graph here, even out to 3 months, 19% of patients still had clear or almost clear skin after treatment. If you look at 1 month, over half of patients were still in remission. So they were still clear or almost clear. 2 months after stopping use of the topical, 28% of patients were clear or almost clear. Remember what I said at the front? I was a little skeptical when I even first started working on this medication. And I really wanted to know, was there truly a synergistic or combined effectiveness combining two of these well-known ingredients into one? And so you can see here, they actually demonstrated that in a study. Here we see in the first column, tazarotene alone, and you see that about 9% of patients met treatment success. Then halobetasol alone, about a quarter of patients. Now, if we combined the results of the two, just by combining their numbers simply from their separate clinical trials, you can see here it ends up being around 32%. When we did the studies on DUOBRII Lotion, the patients had almost 43% treatment success. So you can see there was almost a 32% difference between the two groups. So it was meaningful and clearly showed a difference with combining the two well-known ingredients into one as a DUOBRII lotion, and as well as the new technology of these oil droplets evenly distributing the drug on the skin. Also, the other component of not just improved clearance of the skin, we also see fewer skin-related side effects. So alone, a high-potency topical steroid can lead to thinning of the skin, but retinoids, the tazarotene, can irritate the skin. So those are the two downsides of the individual ingredients alone. But in combination, each component reduces the skin-related side effects that the other can cause. So the halobetasol can reduce the skin irritation associated with the tazarotene, and the tazarotene can reduce the skin thinning associated with corticosteroids. So really the perfect marriage of two topicals together and helping each other, reducing their side effects overall while increasing efficacy in clearing psoriasis skin. And even if you layered these creams separately, they may not work efficiently because one drug can block the other from passing through the skin. And remember, DUOBRII Lotion is also innovatively designed in this new technology to deliver each drug to the affected areas simultaneously and evenly. So here are some examples of what treatment success looks like after 8 weeks of treatment. So you can see there on the left at baseline, some classic plaque psoriasis, red, well demarcated with that silver scale, and then at 8 weeks, having completely clear skin. And in this patient, they followed the patient out another month after stopping treatment at week 12. You can see that the skin remains clear. Let's take another look at another patient. And what happens is that, I said this several times, is that the two separate ingredients really work together. And I want to show you here where the tazarotene is great at taking away that white silvery scale. Sometimes that thick white silvery scale actually prevents the absorption of a topical steroid. But with the tazarotene, it can take away the scale, and then the topical steroid can penetrate and exert its anti-inflammatory effect. So another great example of a patient who was a treatment success on DUOBRII and who used the topical once a day for 8 weeks. Here's another example of a treatment success. And something else I want you to notice is that we're not seeing side effects of excessive thinning of the skin, easy bruising in these photos. And these patients are using it continuously for 8 weeks. And when you think of a strong topical steroid, steroids are graded by their strength, and halobetasol is considered one of the more potent topical steroids, is that most often other strong topical steroids like halobetasol have only been studied for 4 weeks, or your doctor will tell you you can only use it up to 4 weeks. And here we're seeing it used up to 8 weeks as a once daily application, effective and seeing low incidence rates of thinning of the skin or side effects on the skin. So here you see that DUOBRII Lotion hydrates the skin and moisturizes it up to 24 hours. It doesn't leave a greasy residue. And I think you really need to feel it to see the difference in its formulation. And patients have told me that it feels really nice. It goes on easily and feels light on the skin. I always ask patients what kind of topical they want. Some prefer an oil, an ointment, a foam. And I think that's really important because you're putting it on your skin and you want it to feel nice on your skin. Otherwise, it's hard to use on a daily basis. So DUOBRII Lotion was designed for treatment success. 2 well-known ingredients in 1 unique lotion. We saw that there's a lasting post-treatment clearance effect where patients completed 8 weeks of treatment, stopped the topical, and still had clearance out to 1 month. As many as almost 20% of patients still had clear, almost clear skin 3 months after stopping their treatment. The safety profile, there's established safety in the first 8 to 12 weeks, as well as a long-term safety study. So a long-term safety study was conducted where patients were allowed to use it for up to a year, and there were no new safety signals. I also showed you there's this patent new delivery technology, which allows for once daily dosing and also allows the medicine, which is contained in these droplets, to be evenly distributed, and probably also accounts for the new elegant formulation that patients like the way it feels on their skin. And we also showed you a true synergistic effect, meaning the combination of the two was more effective than each of the ingredients alone. So combining it really did provide more benefit than using either ingredient alone. Ortho Dermatologics has a prescription access program. This is so important. I know when I talk to all my patients that they're great medicines, but if they don't have access or it's not affordable to them, then it's really unfortunate. So they've made it easy for patients, depending on your insurance type. You can pay as little as $0 or pay as little as $25. There are different ways. There is a pharmacy card which can assist you with copays. So definitely you can look at the link and find out more about how to get access to DUOBRII Lotion. And psoriasis advocacy organizations like National Psoriasis Foundation and their website psoriasis.org are here to support you and help you. The AAD is the largest association of dermatologists in the United States and has a lot of information on psoriasis and other skin conditions. And here's the link to the Patient Navigation Center for the National Psoriasis Foundation as well. And their website is my favorite website. I always refer my patients here because when they want to learn about new treatments, it has great information about new treatments, even helping patients deal with insurance issues and connecting patients to other people who have psoriasis. And finding a doctor who treats psoriasis is also really important. So Ortho Dermatologics is here to support you. We partner with doctors to support psoriasis treatments and education. They focus on effective treatments, ongoing research for new innovations in treatment, and help patients with copays even when your insurance doesn't cover DUOBRII Lotion, and also provide educational materials like this webinar. So in summary, things to remember. Psoriasis is a chronic skin condition that develops from an overactive immune system. Common symptoms include a raised red patch on the skin called plaques. Treatments can include topicals, orals, and injectables. Eating healthy and staying active is really important in combination with your medical treatment. Simple home strategies can provide relief and comfort. And DUOBRII, which is a combination of halobetasol and tazarotene lotion, is a new treatment that combines 2 well-known ingredients in a unique lotion and has been shown to be more effective than each component alone. DUOBRII Lotion is also available for most commercially insured patients for as little as $0. Organizations and groups are here to support you. Thank you so much for your attention and listening today.
Thank you, Dr. Song, for providing an informative presentation about DUOBRII. I'd now like to present questions we received earlier on behalf of today's webinar. For our first question, what are the long-term side effects associated with DUOBRII? Are there studies available that can be provided?
That's a great question. For a skin condition like psoriasis that is a chronic skin condition, it's really important to understand what the long-term side effects are. So with DUOBRII Lotion, the most common reactions were contact dermatitis. So that's some irritation directly where you applied the lotion. some pain at the application site, some irritation around the hair follicles, and these were all under 7%. So thinning of the skin 2% and itching 2%. I showed you the 2 8-week clinical trials, as well as mentioned the 1-year safety study where the safety results were consistent with the 2 8-week clinical trials. So in terms of long-term side effects, we're not seeing any other or new safety signals other than what was seen at the beginning.
That's great to hear. So another question, how long can you use DUOBRII until it becomes harmful?
So based on the studies, we see that patients used it continuously for up to 8 weeks. And you can also see that in instructions that patients can use it as long as there is a red raised plaque and to continue using it until it is clear. So that comes from the additional 1-year safety study. So I think that, from in my personal practice, if a patient doesn't respond after a certain period of time, then one, I would first check and confirm my diagnosis. 2, see how the patient's using it. There was a great study that was actually done about 10 years ago where a dermatologist actually put a little microchip in a patient's topical steroid tube. And, for all of us, doing a medication every day, twice a day can be really challenging. And it was similar to the dental flossing phenomenon where a patient, when they first got their topical steroid, would use it daily, and then it would kind of taper off and they would stop using it. And then when they were due for their dermatologist appointment, they would start using it again. So it's hard to do a medication every day consistently. So I think that in terms of long-term use, that's why the information from the 1-year study is helpful. Also seeing that DUOBRII has a sustained effect beyond once you get clearance. So after that 8-week treatment period, there were many patients, over half of patients, still stayed clear after a month.
Another question, will I be able to use it on the scalp? What is the recommended frequency of this medication?
Yes, you can use DUOBRII Lotion on the scalp for treating psoriasis in the scalp. It's not meant for oral or eye or use in your genital area. And simply you would apply a thin layer of the DUOBRII lotion once daily to cover the areas in the scalp and then rub it in gently.
Okay, that's great. It's nice to know we have another scalp treatment option. Does DUOBRII thin the skin like clobetasol?
So good question. So while there's no direct comparison data comparing the two, in clinical studies of a total of 418 patients, only 2% of patients experienced skin thinning. So I think this is really confirming the unique action of DUOBRII lotion where the tazarotene has been shown to reduce skin thinning associated with the steroids.
And what advantage does DUOBRII have over traditional topicals?
DUOBRII lotion is really the first of its kind in topical treatments that combine 2 well-known ingredients in a once daily elegant lotion. I really emphasize elegant lotion because you really have to try it to feel it. And I think that my patients have also told me how nice it feels on the skin. And you can use this treatment until control or clearance is achieved, unlike other steroids that have time limits on use. Also, the DUOBRII lotion clearing process is extended. So I mentioned that even with using it for only 8 weeks, after stopping the topical steroid, over half of patients were still clear a month later. And so we see that it has long-lasting effect in patients, and they were clear in some patients even up to a year after stopping.
So that, in a way, kind of answers the next question, which is how long do you have to use the product before seeing results?
So, whenever a patient starts a new treatment, they want to see, well, how soon will I see a difference, right? So with DUOBRII lotion, results were seen as early as week 2. So in 2 weeks, they saw a difference, an improvement in their psoriasis plaques.
The question that comes to mind for a lot of folks is, what is the cost of DUOBRII going to be? Do you know if it is accepted by insurance?
A really, really important question, right? So one of the slides did briefly review what kind of access there will be. At Walgreens and other participating independent pharmacies, most commercially insured patients will pay as little as $0 copay when their insurance covers DUOBRII. While most insurance companies will cover DUOBRII Lotion, for those patients where it doesn't cover, the copay will be as little as $25. So if a patient needs more information, I suggest following the link. It's www.orthorxaccess.com.
That's great information to have. A couple other questions in regards to treatment options again. Is there a conflict with other medications while taking DUOBRII?
So currently with DUOBRII Lotion, there are no known drug interactions.
Okay, that ties into this next question. I am on Cosentyx 300 milligrams every 28 days. I'm almost completely clear. Would I be able to use DUOBRII if I experience a flare?
So dermatologists use combination therapy all the time. So yes, while DUOBRII Lotion has not been formally studied in combination with a biologic like Cosentyx, it is approved or used for the topical treatment of psoriasis. And there are no known drug interactions or what we call contraindications, meaning it is appropriate for treatment flares regardless of using other treatment. So definitely ask your doctor if DUOBRII Lotion might be the right prescription for you.
Okay, so one last question. How would DUOBRII help the dry skin?
Great question. So this is where that unique technology of the new formulation, I mentioned how the technology behind it is that there are actually oil droplets that evenly distribute the two active ingredients while moisturizing the skin. So many patients have said that this advanced formulation actually helps repair the skin barrier, increases moisture retention, meaning that it hydrates the skin with each application. In the clinical studies also with DUOBRII Lotion, many patients saw improvements in local skin reactions, meaning less skin irritation, including dryness, and saw improvements in their psoriasis as early as 2 weeks.
Okay, terrific. Thank you, Dr. Song, for providing such a wonderful overview about this new treatment option. This webinar has been recorded and will be shared with attendees. You will receive an evaluation survey that will be sent to the email you registered for the webinar with. Please take a moment to fill out this survey on behalf of the National Psoriasis Foundation, Dr. Song, and Ortho Dermatologics. Thank you again for attending this webinar, DUOBRII for Patients, Understanding Psoriasis, Treatment Options, Resources, and Ways to Help Yourself. Have a wonderful evening.